If the valve doesn't open fully, it will block or restrict the flow of blood. This is called the valve stenosis or valve narrowing. If the valve doesn't close fully, the blood will leak back into the heart instead of forward into the body. This is called valve incompetence or leaky valve. Now, to educate us more on this topic, I'm joined on the line by Dr. Youssef Saad. Good morning, doctor, and welcome to GMN.
Good morning. Good morning. Thank you very much for having me.
Okay, how is the weather in South Africa?
Yeah, it's pretty nice, but it's not nice and warm like Namibia.
Oh.
So it's a bit chilly here,
Okay.
but it's still shiny.
Okay, it's good to hear that you miss home. Now, some people with a heart valve disorder may not have any symptoms, but if it goes untreated, it can cause worsening symptoms over time. What are the most common symptoms of a heart valve disease, doctor?
The valves of the heart are having a very good, important functional property, and if it is malfunctioning, it can cause a slowly progressing heart failure. And the heart failure can progress either to have water and blood accumulating into the body not being pumped in the proper way. So the body will swell up, the chest will be congested, there will be a chronic persistent cough which is not responding to treatment. There will be swelling of the ankles and the feet. There might be swelling of the abdomen as well. The face and the lips might be congested, cyanosed, bluish in color. There might be a feeling of fatigue, lightheadedness. There might be sort of like tiredness, and it can also lead to fainting episodes.
Okay. Now, perhaps these are symptoms of specifically if someone who perhaps develops it later. But what about some people who are born with a heart valve disease? What can happen if the heart valves are absent or perhaps damaged from birth?
Yeah, those children, usually they fail to thrive, so they are not growing in a normal way. They look a bit bluish in color. They feel like, not able to swallow properly, so they are not growing into the normal pattern of growth. They have stunted growth. They are usually children who are not having appetite to play and to become active and to become sort of like, full children life. And sometimes if they grow into adulthood, they get sort of like palpitation. They feel the heart beating is not regular, and they are aware of some chest pains here and there.
Okay. Now, with these children who are born with these conditions, are they able to receive treatment?
Yes, definitely. This is why it is a very common, important practice that once the baby is born, there is a pediatrician attending to the baby in the delivery room, and they are evaluating the children immediately, the neonates, to make sure that the heart does not have any major abnormality which can be instantly discovered. And then the regular follow-up and check with all the immunization schedule. When the mother is taking the child for immunization clinic, it's a routine checkup that the doctors will check the heart and will check make sure that the child is completely physically normal. Listen to the heart and do some investigations if there is any doubt.
Okay. Now, building of that, obviously with age, the heart valves become thicker, with all this, and once it's damaged. What is the process in terms of repairing this valve? Is it a complex one, or how easy is it to carry out these repairs?
Yes, that's a very important question. In the olden days, surgeons were treating the valve by only open heart surgery, which was a very complex surgery. We need to stop the heart from beating, and we need to divert the circulation into what we call a heart-lung machine, which was a very massive operation. But more and more with advanced technology, we are using less invasive and more conservative surgeries. And nowadays, there are some techniques which can be fixing the valve by firing a small little artificial leaflet on top of the old damaged valve through a catheter which is inserted from the vein, either the femoral vein in the groin or the brachial veins in the arm, and we go with the catheter to the valve, and then we fix it without even opening the chest at all. And some complex cases are still done by open surgery, but it's a mini surgery, which is having very tiny little scars.
Okay. So different heart valve diseases require different interventions. Now, doctor, it's our understanding that there are basically three types of heart valve diseases. Among these three, perhaps, which one would you say is perhaps most common in Namibia?
The regurgitation is commonest. There are three different types. One of them is stenosis, when the valve is closing up so that it doesn't allow enough flow of blood between the leaflets. We call it a valve stenosis. And there is one which is called regurgitation, is when the valve leaflets are becoming wider and they are causing the blood to flow back. And there is one which is congenital called valvular atresia, which means that there is a narrowing or almost a blockage of the heart, and it is happening since birth. So I think regurgitation is the commonest one, which is happening usually with age and with heart failure, and it is luckily the easiest one to treat medically and surgically.
Okay. Now, doctor, how do you treat a blocked heart valve without necessarily undergoing surgery? Because some people perhaps would say, we gotta go surgery, but is there a way to treat it without actually going into surgery?
Yes, nowadays we have a lot of technologies by using what we call a balloon dilatation, and it's the same principle. Nowadays we have a lot of advanced techniques that we can go by catheters or balloons from the vein until we progress until we reach the valve which is affected. And then we blow a balloon under specific calculated pressure, and under monitoring, we see what is happening under the monitor, and then we can cause a bit of dilatation or induce some dilatation of the narrowing of the valve leaflets. And as I said earlier, if there is a regurgitation and the valve leaflets are a little bit loose, we can fire some sort of like artificial cover on top of that leaflet, which will enforce it and make the space proper in diameter. So we use this, we call it transcatheter valve repair, which is becoming a common procedure now.
Okay. Doctor, as we wrap up our conversation this morning, and in your parting thoughts, how does one then keep a healthy heart valve? And then how often should one go for a heart checkup just to ensure that everything is fine?
Yeah, it's a very important question. There are two types of valve disease. One of them is ischemic, and that is the one which is coming with heart attacks, people who are eating unhealthy, not doing sports, having cholesterol and blood sugar levels abnormally high, and those ones will have the muscle of the heart affected, and that piece of the muscle which is adjacent to the valves will be affected as well. That is, we call ischemic heart. And the treatment for that is, or the protection for that is to try to be having a healthy lifestyle, eat more fruits and vegetables, regular exercise, control your cholesterol, and have a regular checkup of blood sugar and the blood cholesterol. We recommend that this checkup need to be done as from the age of 35 every year. Annually, we do a blood test and we visit a clinic or a doctor for a regular follow-up. However, there is another type of disease which is happening in children, which is common called rheumatic fever. And that is a type of infection, commonly throat and tonsils infection. If it is not completely treated properly with antibiotics, it causes some toxins which will circulate in the bloodstream and it will affect the valves of the heart. We call it rheumatic valvular heart disease. And to avoid that situation, the best is children who are feeling sick, fever, tonsillitis, they need to seek medical advice and receive a proper full antibiotic course to try to prevent this situation from happening.
Okay. Now, doctor, perhaps what about those that, especially during COVID, those that suffered from COVID and that had issues with their heart, they had blood clots? Are they at risk of developing this kind of diseases? And how should perhaps is there a possible recommended treatment for who are still having side effects from COVID, especially with regards to their heart valves and hearts, perhaps in general?
Yes, that is a common entity. We have a lot of conditions. We call it the post-COVID heart conditions. And those are the people, as you correctly said, because of blood clots, which were in the lungs, causing a high pressure into the lung circulation, which will eventually cause a back pressure in the heart. So those people should be continuously under monitoring. And we recommend that most of those guys under medical supervision will receive something like a blood thinners, which will be helping the blood to flow easily and not cause too much pressure on the lungs and on the heart. But there is a whole lot of evaluation because cases might differ. So they need to have proper evaluation of the heart valves and the heart pressure inside the heart. We have a lot of ultrasonography advanced machines. We call it echocardiography, which is able to check the valves, able to check the flow of the heart if there is any regurg or any stenosis. And obviously, the specialists will be advising on how to best to treat each condition accordingly.
Okay. Well, doctor, thank you very much for making time to speak to us this morning, and please do enjoy your time in Johannesburg.
Thank you very much. It was a pleasure and an honor to be with you. Have a beautiful day.
Likewise. Now, that was Dr. Youssef Saad, who is a surgeon, speaking to us all the way there from Johannesburg on the important issue of leaky heart valves. He also did advise, also especially with heart conditions that came as a result of COVID, to ensure that you take prescribed medication, go see your doctor for proper assessment and recommendations so that you can ensure to get the correct medication to ensure that your blood flows as frequent as it's supposed to be or flows properly in order to ensure that you continue living healthy. Now stay tuned. GMN gets returned shortly after this break.